This is Steve Zeltzer with WorkWeek Radio, part of the Morning Mix at KPFA Pacifica. Cal OSHA is the agency that is responsible for protecting the health and safety of California's 17 million workers. The continuing explosions of refineries such as the Chevron in Richmond and retaliation against workers who report health and safety problems is a growing problem in California. Ellen Widess, who was the chief of Cal OSHA, was recently removed by Governor Brown's new appointee to the Division of Industrial Standards, Christine Baker, and replaced by attorney Juliann Sum, who is an advisor to Christine Baker. Sum had been a key figure in supporting SB 863, which eliminated medical coverage for workers having depression and psychological problems after injuries. California has only 160 OSHA inspectors for the entire state, and there are more fish and game inspectors in the state than OSHA inspectors. The employers and corporations have welcomed her firing, say that they should not have punitive action and fines against them for violating the Cal OSHA rules. And the Cal OSHA Reporter, a publication, was criticized by health and safety advocates for favorably reporting on her firing. Joining us this morning is Dr. Larry Rose, the past director of the medical unit of Cal OSHA, Gail Bateson, director of WorkSafe, which organizes around health and safety, and Barbara Clark, an injured nurse practitioner who was injured on the job in San Bernardino and is on the board of the directors of the Injured Workers National Network, IWNN. Welcome to the show, all of you.
Thank you. Thank you.
Thank you.
Yes, thanks.
Now, Gail, this controversy which has been going on over the removal of Cal OSHA Chief Ellen Widess, why did this happen?
We don't know. We've not been given an explanation about it, but we do know that the business community was putting a lot of pressure. They were not happy with their loss of a cozy relationship with Cal OSHA, which had existed in the past.
And what does the business community want at Cal OSHA?
Well, basically, they want to keep pushing on more and more rules that make it harder for Cal OSHA to issue citations and to hold employers accountable for health and safety. They have a lot of rules we're trying to get taken away, but they're also trying to make it even harder.
Would that include some of the citations at the Chevron refinery that fined them and said that they were doing very serious violations of Cal OSHA rules?
Right, but it's also a whole process that they keep adding to make it harder for the agency to even issue serious citations in the first place. They keep wanting extra steps added to the process. And then when they get the citations, they have this long legal system that they can use to delay even fixing the hazards till things have gone through the courts. So they can stall even serious violations of health and safety regulations for years. Has that gone on much? Very much, yes. It's a good example would be the BART death that happened in 2008, where they, instead of fixing the problem, a worker again killed on the tracks. Instead of fixing the problem, they're just taking it to the courts and spending tens, if not hundreds of thousands of dollars on lawyers. They actually spent $300,000 on outside lawyers at BART, the BART Board of Directors and managers, fighting the citation on the death of Jane Strickland, who was killed 2 years ago. Right. On top of the worker who was killed in 2001. So these are now the third and fourth deaths that have happened at BART to BART workers on the tracks. So you see this as a systemic weakening of any real health and safety protection if they can ignore the OSHA rules? Well, they've been able to make the OSHA rules work in their favor, because there has been a law that if you want to fight a citation and you have a serious hazard, you don't have to fix it until you've gone through the courts. And, if I was driving a car down the street with failed brakes and I crashed into something, they wouldn't let me keep driving my car around for months or years. But that's what they let the companies do. And we had a bill that we were very successful in getting passed by the legislature, sponsored by Nancy Skinner, and then the governor vetoed it. What bill was that? That was AB 1165. And what would that bill have done? That would have said that whenever there was a citation issued for a serious or willful violation, that the company would have to fix it, and instead of being able to delay the fixing until they'd gone through this court process. They could still come in and request a hearing if they disagreed with that decision, but the automatic assumption would no longer be that you could wait months or years. And when Governor Brown vetoed it, what was his justification? Well, he claimed that there's a new expedited process that puts serious and willful citations to the front of the list, but that's still a matter of, at a minimum, 4 to 6 months. And in the meantime, all the workers at that job site are still exposed to the hazard. So it's a very dangerous situation. It is. So we're talking with Gail Bateson. She's the director of WorkSafe in California. They have a website, WorkSafe. And also joining us is
Dr. Larry Rose, who's the former medical director of the medical unit, which apparently no longer exists at Cal OSHA. I guess they don't need doctors at Cal OSHA. Welcome to the show, Dr. Rose. Now, you have been fighting for a number of years to increase the number of inspectors, and Cal OSHA only has 160 for 17 million workers. What's the state of affairs for protecting the health and safety of workers in California, Dr. Rose?
Yes, well, of course, the only strength of Cal OSHA is its enforcement. And what's been happening over the years is a direction toward what OSHA is calling, Cal OSHA is calling voluntary protection program, where let the corporations set their own safety standards and they'll take care of it. Well, that doesn't work. We have a very good labor code in California and a number of very good labor standards, but they're only going to be enforced if there are enough enforcement staffing at Cal OSHA. There's one per 90,000 workers, which is a ratio that's unacceptable and is not going to allow Cal OSHA to do its mission. Now, Ellen Widess believed in that mission, and she did a number of excellent things to help low-wage, high-risk workers. Aside from what she did at the Richmond Refinery, which was issue several what's called very serious citations, willful serious, which implies that the management at that Richmond Refinery was involved in creating the situation of the explosion and the catastrophic events that ensued. Ellen Widess, in addition, did work toward warehouse owners and contractors in doing citations for both hotel employees, heat fatalities, confined space deaths, and the big one is retaliation against workers that would complain about health and safety conditions. So she was an excellent chief of Cal OSHA. Now, I believe that what she did at the Richmond Refinery, the Chevron, was the grounds for which Brown moved to get her removed. And another thing, that the major administrator at the Department of Industrial Relations is Christine Baker. She's been involved in diminishing the rights of workers that are injured. And then she, as her special advisor, pushes one of them in, Juliann Sum. I'm not saying Juliann Sum is unqualified. The point is that Christine Baker and Brown are riding tight rein over Cal OSHA and reducing its enforcement capabilities. And this, I would find, should be unacceptable for all workers in California.
And you were listening to Dr. Larry Rose. He's a last medical director at Cal OSHA. And was a doctor there. Also joining us is Barbara Clark, and Barbara Clark, welcome to the show. And you were injured on the job in San Bernardino, in Bakersfield, and at a AgriQuest at a Adventist Health System hospital. You had a injury on your neck. What has been your experience with Cal OSHA and the system to protect workers in California?
One of the things I have to say from listening, and thank you for inviting me to the show, is even in workers' compensation and in OSHA regulations, there are really good rules in place. Where I see the problem is that when injured workers bring up an issue or workers bring up an issue of health and safety and they want to follow the rules, then there's always someone in the chain of command that kind of dismisses it. And that was one of the issues actually I ran into while I was still employed at the Adventist Health System. When I came there, when I was asked, it was the Adventist Health System that sought me out and wanted to bring me on board as a nurse there. And when I went to the unit, very quickly, I realized how unsafe the unit really was. And there were issues, and these were issues that you use in the dinosaur age. There were oxygen did not come out of the wall. Oxygen was in bottles. The bottles had to be taken down 3 flights of stairs to be changed. Then there were people that couldn't change them in time, so then I had patients that needed to be on oxygen and no oxygen's available, and cords lying around and faulty electrical connections. And I did bring this up to Cal OSHA, and I said, look, these are real, these are tripping hazards. These are patient safety hazards. These are hazards for the nurses. And, of course, they went ahead, whatever they did with the hospital, well, it was the hospital that came at me and said, you need to quit complaining about all this stuff. This is just fine. And what ended up happening is because of the unsafe situation and working conditions is how I actually got hurt, because I was in a room that was way too small, that was not even according to OSHA standards, and the patient kicked me in the head, and because I stood 12 inches from a concrete wall, my head hit the concrete wall, breaking my neck, knocking out my teeth, breaking my jaw, and then I'm thrown into the work comm system, which now 18 years later, I'm still waiting to get my teeth fixed. And everything that I have gotten medically has had to be put on the federal Medicare program, which now is the cost shifting again. So I think it's really important to look at all factors, not only injured workers, but how do these injured workers get hurt? Are they getting hurt because the safety standards are so bad? And I think that's a big issue. That's a huge issue.
Okay, we're listening to Barbara Clark. She's with the Injured Workers National Network Board, IWNN.org. And it seems like far from getting better, things are getting worse at Cal OSHA. Gail, what do you see the future as? Because if they can get rid of a strong advocate for Cal OSHA here, the chief, Ellen Widess, it doesn't look good.
Right. I would say that right now the staffing level is the lowest that it's been in at least a couple of decades. This is at a time when California has gone ahead and passed new important standards to protect workers like heat and injury and illness prevention plans and protection from infectious disease. And so when those laws happen, you need even more inspectors. But we're just getting smaller and going in the wrong direction. At the same time that even though things are tough all around, other states in the federal system are actually growing. Obama, who has not done as much as we would like, is at least every year adding more to the OSHA budget, adding more inspectors. They're going in the right direction. We're going in the wrong direction. And what's really galling about this is that there's money in the budget to do it. There's money that's been appropriated by the legislature, but it's not being spent.
Okay, that's Gail Bateson. She's director of WorkSafe. You can get that by going to WorkSafe and on the Internet. And also joining us was Dr. Larry Rose, the last medical director of Cal OSHA, and also Barbara Clark, barbaraclark.org, barbaraclark.org, or IWNN.org. I want to thank you for joining us this morning. We'll cover it more in the future. Thank you very much for joining us.